Marion Tepke McLean. I live in Dexter. I'd like to thank you for all your work on behalf of peace. I'm a peace activist myself, and I would like to address the issue of drone warfare and extrajudicial execution. I think this is a real slippery slope. It is a moral and ethical consideration. I've heard it defended by a lot of people. I think that there is no good in it, but I'm kind of curious to think of how your opinion is developing on the issue.
Yes. So in regard to the drones, I saw a survey related to Pakistan, and I won't have the numbers quite right, so if the Oregonian PolitiFact is here, these are general numbers. I'll have to check the exact source, but essentially it was, and there were caveats about how difficult it is to survey in Pakistan and so forth, but it said it was something like the high 80s to 90% of the people in the country felt our drone strikes were wrong, and it was something like mid-70s felt that the U.S. was an enemy of Pakistan. This is our ally. And it was, I may not have the numbers quite right again. I can get you the exact numbers if you'd like to see them. But try to imagine that here we are in this gathering, and down the street, a drone comes out and blows up a house, and maybe there's a family in it. And we all know someone, because we're in that community. What feelings we would have about those who sent that drone from halfway around the world. Those are the feelings that are generated. And so my gut sense that if you want to lose a battle for hearts and minds, that's a really good way to do it. And that when you target a killing like that, you are likely to generate multiple enemies in taking out one enemy. So I think it's very important to have an extensive discussion of this. I asked, there is a very highly discussed drone strike about a circle of elders that were struck. And I asked it, and I was being told there are virtually no citizens, no non-combatants that are killed by drones. In fact, the assertion from the national security world was basically almost none. Very, very few non-combatants. And I said, well, you know, there's this famous episode of this Council of Elders, and you're telling me you're confident of this because you have all these film and footages from the devices and the surveillance and the mothership, or however that's done there. And so I said, I'd like to see the footage on that particular strike so that I can see firsthand this issue that's been debated. They have never let me see that footage. So just to give you a sense of
They're lying.
I won't jump to that place, but I'll just say that they didn't want me to see it. So, so I have a lot of concern about that strategy, and hope we'll keep raising it as a national discussion. I want to just close by thanking you all so much. And nobody asked about health care. Well,
We all want single payer.
Can you do it overnight?
I want to give you a little sense. I want to give you a little sense on some of the things that are related to the Affordable Care Act that have already happened. And there are many pieces of the Act. The state website, of course, we know is a big flop. And the state's working with Oracle to try to change that, but right now we're having to operate from paper. I did invite David Berenberg to come. David, to wave your hand. If anyone has had difficulty with the website, or has someone close to them who's having difficulty, David can help connect them with the experts. I think the most recent numbers are that the expansion of Medicaid and the signups for insurance through the website, through the marketplace, if you will, are, even though it's by paper, it has now hit 150,000. And so it's gaining some momentum. But we would like to get to the electronic end of things. So David has cards, and we have help, and I really appreciate, he's come to all my town halls, so to be available to assist people on this. But let's talk about some of the other pieces of the Affordable Care Act. More than 20,000 Oregonians have received rebates under the 80% provision. Now, it used to be an insurance company could spend a lot of their money on administration and not deliver health care. Now they have to deliver 80% of their funds have to be spent on health care. So more than 20,000 Oregonians have gotten rebate checks when their companies fell short in this regard. More than 30,000 have saved money as we've proceeded to start closing the donut hole in Medicare Part D. We're at the 50% level, and it gets completely to the 100% level by the year 2020 under the plan. I imagine there's some folks who have benefited from that in this room. We've had more than 40,000 young Oregonians, 19 through 25, gain coverage through their parents' policies because of the age 26 provision. We've had more than 900,000 Oregonians take advantage of free preventative care, which goes right to the heart of an ounce of prevention is worth a pound of cure, and we didn't have that in the past. We have 1.3 million Oregonians who no longer are subject to lifetime or annual limits. This is a situation you have, there were these practices. You thought you had insurance, and then when you got hurt, after a few days, you had an annual limit or a lifetime limit that ran out. And it's like, whoa, I didn't actually have insurance. Or you thought you had insurance and you got sick, and then you get a letter upon renewal saying we're not renewing your policy. It's called a rescission. You got kicked off your insurance when you were, if you say you had a serious disease, you still had that disease. And then you had a pre-existing condition, you couldn't get insurance at all, unless you were fortunate to be able to get it through an employer. And so, and in regard to that pre-existing condition piece, I would say the majority of us in this room have pre-existing conditions. Not because you all look ill, but because the statistics are that for folks in their 50s, about 45% of us have a pre-existing condition that could disqualify us under the old system. And as you go to your 60s and 70s, the numbers go up. And so that is a huge challenge that didn't make the insurance structure work. Plus, we have the potential for the competition between companies in an apples-to-apples framework that hopefully will drive prices down. Now, there are things that are not going to work. And here's the heart of anything this substantial. You've got to keep the things that are working, and you've got to fix the things that aren't. And whether you're a Democrat or a Republican, or you come from the East Coast or the West Coast, we need a problem-solving mentality to come together and make health care work better for all Americans.